Hiccups are a phenomenon that occurs in the diaphragm, an involuntary reflex movement that everyone displays, even before birth. In this AllForBabies video, we will see how to stop hiccups in a baby with 14 tricks, so you can help your child get rid of hiccups. Change position. If the baby is eating at that moment, we should change their position in order to reduce the amount of air they swallow, especially if they are being bottle-fed, as the nipple adapts less to their mouth than the mother's nipple. Take breaks. Make small interruptions during feeding to allow the baby to eat more slowly. Offer a pacifier. If hiccups occur after eating, offering a pacifier can quickly stop them. Breastfeed. Offering the breast can help stop hiccups in a newborn baby. Even if it was the triggering factor, breastfeeding will also stop the hiccups due to the sucking action. Question popular methods. There are methods used by many people that should never be practiced with our children. This includes covering their nose or startling them, which is used in adults to immediately stop hiccups. This method is not recommended for babies as it can upset them, make them cry inconsolably, and may cause them to develop fear of certain situations. Give them a teaspoon. It can be breast milk or formula. Swallowing in this way will likely make their hiccups disappear. From 6 months of age, a teaspoon of water can be used instead of milk. Burp them. Just as gas is expelled from babies after feeding, we should hold the baby upright, with their head resting on our shoulder, and gently pat their back. Trigger a sneeze. To do this, gently pass a clean cloth over their nose to provoke the sneezing reflex, which will interrupt their hiccups. Older children who can identify hiccups can use other tricks to get rid of them. Additionally, many of these tricks will be quite fun for them and they will enjoy doing them. Hold their breath. For a few seconds, have them hold their breath by covering their nose. They should take a breath through their mouth and briefly cover their nose to allow the diaphragm to recover. Drink from a glass upside down. By drinking water from a glass on the opposite side than usual, the airflow changes and the hiccups will stop. Cover their ears. Do this after taking a breath to stimulate the vagus nerve. With the relaxation that occurs, the hiccups will likely stop. Recall something. A commonly used trick with children to stop hiccups is to ask them to think and say aloud everything they ate for dinner the previous day. Their attention will be focused on something else, and by the time they finish thinking about the menu, their hiccups will have stopped. Take deep breaths. Deep breaths will help relax all the muscles in the body, including the diaphragm. Apply something cold to the abdomen. This will change the rhythm of breathing, and as a result, the hiccups will disappear. It can be a cold bottle, for example. Many of these tricks work because they activate or deactivate muscles and nerves involved in the hiccup process, while others stop hiccups due to the time invested in doing them, as they take longer to perform than hiccups usually last on their own. If you have any doubts about your child's condition, whether it's the type of hiccups or their duration, we recommend discussing it with their pediatrician. See you in the next AllForBabies video.